Hey everyone, welcome back. My name is Kelly Troutman. I'm a certified hand therapist. Today I'm going to be showing you one way that you can use kinesiology tape to tape for carpal tunnel syndrome. So this is by no means the only way that you can tape, but it's one way that I've been using recently and my patients seem to really like it. So that's what I'm going to be showing you. All you need is kinesiology tape of some sort. I'm using Kinesio tape just because that's what I have at home, and I actually really like that brand a lot, but definitely not a sponsored video, just the tape brand that I tend to use the most at work. And then you're gonna need scissors too. Let's get into it. So to tape this way that I'm gonna show you, you're gonna need two separate pieces of tape. One piece of tape needs to be fairly long because you're gonna be taking it from the back of the hand through the fingers, down the forearm, and then back behind the medial epicondyle because it's going to be helping with the flexor muscles. So it's like an inhibition of those flexor muscles. And the other piece of tape that you're going to need is just a little bit smaller, just to kind of go across the carpal tunnel and then back around the hand. I do not personally measure in blocks of tape, so sorry if that's the way that you like to do it. I just kind of estimate based on what the patient's hand looks like and kind of what the size of their arm is, and then I cut the tape from there. So that's just how I do it. The first thing that you're going to need to do is on your long piece of your tape, you're going to fold back the edge and you're going to cut two little triangles in the tape so that it ends up looking like this, so that you have two little diamond cutouts. Can you see that? Kind of. Okay. You're going to rip the paper backing. I rip right around the holes just because it's easier to get control. And then peel that part back. And then those two little holes are going to go over their middle and their ring finger with the smaller side of the tape on the back of the hand. So you just kind of slip the fingers through it like that. And then you're going to peel back this part of the tape. No stretch on this part because it's just adhering it to the back of the hand. Also, sorry, this tape is super crinkled. I didn't want to waste it, but it got stuck at the bottom of my work bag, so it's all kind of janky, but that's okay. Just for a demonstration, you guys will get it. And then the next part that you want to do is you're going to have them extend their wrist as far as they can and straighten their elbow as much as they possibly can, so that you get a little bit of tension on that tape as you are applying it. So let me just peel this back a little bit. So again, extended wrist and extended elbow. You're going to peel it back and go all the way along the flexor muscles. And then the end, I don't do any tension. Just taking it back around the medial epicondyle and around the elbow to adhere it, smooth it out. So that's your first piece, which is kind of hard to tell because it's like the exact same color as my skin. Sorry about that. Okay. And then for the second piece, which is a little bit hard to apply for yourself, if you're doing it on a patient, you want to tear down the middle and then give them about 35% stretch over the carpal tunnel and then no stretch on the ends. Because I'm doing it myself, I won't be able to get as much stretch on it, but I'm still going to rip down the center of the paper. I'm going to stick it to the palm, like right in that carpal tunnel area, like that. And then I'm actually going to do just a light tension on each end, about, again, like 35%, just to the back of the hand. Paper off, no tension there on the end. And then same thing on this side. I'm just going to give it like a little bit, like a 35% tension across the carpal tunnel, tag it down, and then no tension to wrap it around the back. Sorry, I'm bad at showing this. Just like that. So that's like kind of your end result. Hard to see from here, but it feels really nice. I don't have carpal tunnel syndrome, but it even feels really nice to me. So it's just like a nice little supportive, decompressive taping that a lot of patients have been really liking lately. So Anyway, just wanted to share that on video. Thank you guys so much for watching. I hope this video is helpful. If you use this technique or if you have any other kinesiotaping techniques that you like to use for carpal tunnel syndrome, please comment below. Give this video a thumbs up if you enjoyed it, and don't forget to subscribe. See you next time.